Thank you so much. It's a great honor to be here with you this morning. We are now in a very sensitive time. Sometime I compare it to a football match. You know, there is the overtime. We know that we have now a safe and efficient vaccine that is available. We have already the approval by FDA of Pfizer, and later today, there's going to be another hearing of Moderna, two companies that Israel signed agreements. And I'm sitting also on several of committees that are following and will give the final approval. Next week, Israel is going to start vaccinating, especially the healthcare workers, especially those working with high-risk patients. We're going to start a mass vaccination campaign, first with the elderly, especially in institutions, and later on, those who in high risk. And afterwards, finally, gradually, all parts of society. And we're very lucky because we have in the coming month, we have enough vaccines, as it seems to be right now, for all the population in Israel. This will be a game changer because finally, this is the right way to get into herd immunity. Actually, now we're preferring maybe the term population immunity. Herd immunity is a term coming from veterinary medicine, but we prefer maybe to talk about populations or community, not necessarily about herds. I'm saying that because in the last few months, we heard lots of discussion about natural herd immunity by letting people being infected, and this is something that is irresponsible. By the way, it's interesting that those who are supporting the natural herd immunity now are against vaccines. So I think it put them in a bit of a strange kind of argumentation. So this is a game changer, but we know that this is going to lead us to herd immunity, only in the coming months. Probably something around March, April. And this is in many ways much beyond our expectations. You know, if you tell me about 6 months ago that this would be a situation, I'll be extremely happy. But now we have these coming months, and we are in a very sensitive position because after the second lockdown, we are now facing again a rise in the number of cases. We are now above the number that was set by the government, more than 2,500 new cases per day on average. We are reaching very soon the R coefficient of 1.32 that was set as another standard. We are now above 1.2. It depends which populations. And it's quite clear that since vaccination going to have the effect only in 2, 3, 4 months on the population level, that we need to see what are the measures that should be done. Now, many times the discussion is very simplistic because most of the time, and I can understand the public, this question is, you know, is it going to be a lockdown, not going to be a lockdown? So we have other tools than just lockdowns or restrictions. Probably the most important ones are testing. Israel has now the ability to test up to 100,000 tests per day. And we need to be very efficient here. And unfortunately, we have work to do. I'm talking mainly about doing more testing in red and orange high-risk zones. Also, more testing in the educational system. In any case, learning from previous experience, this time, even if there are going to be more restrictions, schools are still going to be open. This is something that we learned. Of course, children can be infected and infect other people, but we know that at least for COVID-19, comparing to other upper respiratory infections, for example, influenza, children are less infected and less infecting, especially those up to the age of 10. So schools are going to be open, especially elementary school. And for high school, we're going to have a hybrid system. But in order to do so, we need to have much more testing. We had several pilots about mass testing in schools, including with pooling. Pooling is the idea that you take many different tests all together in order to save, not do testing for every child. And if in the pooling system you have a positive one, you can go back to the children and check them individually. Other things that I'm very frustrated, and also the experts are frustrated, is the question of returning from other countries. We know that we are importing so-called cases from red countries. One of them, several countries, especially it was true for the Arab population returning, for example, from Turkey. We also have the United Emirates, and there are different considerations now. One, to improve testing of all those returning. And the second, maybe in the current situation where community transmission in Israel is so high, to see that maybe all people returning from all countries will be in isolation and will be doing testing. Another important difference now that Israel reduced the number of days for isolation from 14 to 10 if you're doing 2 tests. One in the first few days after isolation, and the second one on the 9th day, and then if it's 2 of them are negative, you can be released after 10 days. We are preparing now for a mass campaign, doing lots of both media and meetings with especially healthcare workers. I myself, in the last few days, was giving many lectures. The Ministry of Health prepared a very nice campaign. This is together with the Israeli Medical Association, learning from previous mistakes when the professional association are not exactly taking part in the decision making or given all the information. We learned that they need to be involved and engaged. So, for example, yesterday we had a major meeting with the Israeli Medical Association and a different professional organization. I belong to the Israeli Public Health Physician Association, but also the Infectious Diseases Association, pediatrics, family medicine, others, all are now supporting the vaccine. So I think that many people that were hesitant, according to different surveys, I don't think this will be a major problem. This is my impression, but we still need to make lots of efforts. One of them that is really interesting is creating a task force to answer all of the fake news and taking care of different messages being transmitted on Facebook, WhatsApp, Instagram, etc., and either deleting them or having a tagging, have a tag that this is actually fake news. So next week, they're going to be, beginning of next week, there are going to be discussions about what measures should be taken. I can say that I'm personally against the total lockdown. I think we have many different other measures. I think that unfortunately, malls and other potential mass gathering places, especially just during the holidays. We're finishing Hanukkah now, but there's still Christmas, Novi God. We probably need to close, unfortunately, malls. Again, schools, we still think should be open, as I said. Elementary school, high school, maybe in a hybrid option and massive testing. And continue with giving the message that although vaccines are here, we're in a very dangerous situation right now because the numbers are rising. And we already see, because there's always a delay of about 2 weeks, we see the start of rising of the number of severe cases. And later we'll see the rise, unfortunately, the number of deaths. So in the coming 2-3 months, we still need to continue wearing masks, avoiding, doing the physical distancing, hygiene. This is on the personal level, on the community level, preventing mass gathering, including with efficient enforcement, giving more power, more authority to the local authorities, to the municipalities. There are many civic society organizations that are involved in explaining and also enforcing the different measures. And in terms of contact tracing, we continue with the collaboration between the Ministry of Health and the Home Front Command. Contact tracing became much more efficient, but like many other countries, we're facing the difficulties of people sometimes not telling or not having the memory who they're being in contact with. So compliance maybe is not perfect, better than it used to be. Sorry, and so altogether, these are all different measures. Sometimes it's been compared to Swiss cheese, different layers. There is no one thing that is going to solve all of the COVID-19 challenges, but if you have all different layers from the individual behavior, community, municipalities, and central government, not just Ministry of Health, but also the economic aspects, the social and welfare aspects, altogether is giving you a much more comprehensive approach. Maybe just to finish before questions, I want to say that what we see now is finally some reduction of the R coefficient among the Arab community after lots of efforts. Still, there's a lot to do there, but we have a very good collaboration now with the Arab communities. Again, not perfect, but better than it used to be, especially from mayors. And we see now again a rise in the ultra-Orthodox community after some time that numbers were down. Now in Jerusalem and Bnei Brak, we see again some rise in the number of cases. Again, showing us that natural herd immunity is not a good concept. Herd immunity will be achieved, or population immunity will be achieved only with vaccination. This is it, and I'll be happy to answer questions. I see someone talking here about the idea of a green passport. So I personally, it's a very good question. I personally think that it's an excellent idea, but we should approach it in a very sensitive way in order not to infringe on privacy, and also from ethical point of view, and I'll explain you what I mean by that. So I think that having on our smartphone an application that can show your status, either if you were vaccinated or if you have a positive serological testing, meaning that you were infected, or if you did different tests, all of that would be available here. And it's mainly technological question, not so complicated, but of course there are legal issues and ethical issues. Just to give you an example, let's say that we are saying that you can use your green passport to enter to the theater. Now, what about people that cannot be vaccinated, or maybe it wasn't their turn to be vaccinated? And even if they refuse to be vaccinated. So I think that now with the rapid tests, we can have those rapid tests. This is tests for antigens available. You can get the results in 15 minutes. So people that they don't have the green passport from a variety of reasons, so they can have the test. So we are not infringing on the rights. On the other hand, it's still giving an incentive for people to have the green passport, because then they can enter without doing the test and waiting in line for 15 minutes. Again, there's still question who should pay for these tests, but this is just one example. I think on the long term, this would be important, because I think this green passport should be not just for COVID-19, but for other vaccinations or other important factors. It can be used also by the airline industry. Of course, we need here international collaboration. But I think that if we have so many other private matters on our smartphones, and sometimes we're showing them, I think we crossed in a way the psychological line of using it this way. I know that some people are still resisting, but we can have a committee together with people from social sciences, ethics, and I think most challenges here can be solved, and it could be an interesting option to promote.
Thank you. Do we have any more questions? Go ahead.
Yes. Thanks a lot for this enlightening lecture. Professor Davidovich, I wonder what's your evaluation regarding the extent in which the government has taken or has not taken decisions because of political considerations. I mean, as a scientist, as a person of medicine, can you say, I think that for all the citizens, it's quite obvious that's not the situation, that the government behaved according to epidemiological figures, really according to professional considerations, or politics were in the midst of everything all the time?
Okay, so it's an excellent question. I want to say that when I'm teaching public health, I'm responsible. I'm the director of the School of Public Health, and also responsible for the government exams for public health physicians. Politics is part of public health, but the question, what kind of politics? And I'll explain what I mean. Politics in social sciences is the question of power imbalances, is the question of how you engage with different parts of society, including, for example, the ultra-Orthodox or Arab communities or other communities, how you take into consideration socioeconomic status, etc. So saying, you know, I'm a scientist and I don't deal with politics, I think it's naive and even dangerous. Having said that, it's not a secret that the political situation, political from a party point of view, you know, there is now a very, you know, tricky time where we have a government that should be united, you know, the Likud party and the blue and white party. On the other hand, probably the big chances that next week the government will be dissolved. Now, this has, of course, a very large influence on all discussions. A few months ago, when we suggested the traffic light system to have, and that's something I forgot to mention, that of course Israel is working according to the traffic light system, meaning different risk. So we have red, orange, yellow, and green, and it's how to calculate it, changing from time to time. And here there's also some politics, because different groups, you know, asking, you know, why this standard or that, or why the line is here or there, and this is legitimate. What I'm saying here, that many times, because the government is not really so much united, this creates difficulties in terms of even sometimes paying enough attention to suggestions and promoting them. On the other hand, at least within the professional circles, the expert cabinet I'm taking part of, the discussions were very, very professional. We were aware of the political consideration, and sometimes indeed very frustrated that some of our suggestions were not taken because of different non-epidemiological considerations. Is this unique for COVID-19? No. Maybe now because of the crisis, things are much more, rapid and intense, and decisions, about infringing our liberties are much more dramatic than day-to-day public health decision making. Can give you many examples about tobacco control, and if you think that politics is not involved there, so this is also naive. Now in Israel, because of the political situation and the crisis, of course, it has effects also on efficiency in decision making, and probably different politicians may be thinking about the coming elections or things like that. I hope that, and I've said it many times, that we need to have politics as much less involved in the proper decision making, and especially in conveying the messages to the public, including about vaccinations. And I think the fact that Israel is going to be one of the first countries in the world to have mass vaccination campaign is a great success. And of course, I guess that many different politicians and people would like to take the credit for that. But we will continue with the vaccination process, and we continue with making our scientific considerations and proposals. And of course, when I'm saying scientific, it also includes social sciences. So it includes also understanding the structure and the power relationship within Israeli society. I hope I answered the question.
Yes, thanks a lot.
And if you just can tell me, I'm curious, your name and where you're coming from, it will be interesting.
The last question was from Hannah Berry, I'm correspondent Latin America and Spanish media.
Okay, thank you.
Thank you. Thank you.
I know that you said that I'll
again, if you can present yourself, it would be nice, because otherwise I feel like I'm talking to
sure
to God or something.
This is Tal from MediaCentral. I know that you said that you think lockdown is unnecessary. Well, it's not the only option, and there are other options out there. But after listening to your last answer, would it be correct to conclude that a lockdown or a third lockdown is inevitable?
I don't think it's inevitable, but if we continue not taking the many other measures that were suggested that are there on the table, finally we'll get into a situation like in August, September, that finally we got into lockdown. I personally think that sometime you have a lockdown, and I think that this is not just in Israel. I think that finally this is a sign of a failure, meaning that there could be previous measures that could be taken. So when you get into lockdown, and sometimes you need to do it, it's the last resort, and also maybe representing a failure of, very inefficient enforcement, maybe a very inefficient way of dealing with now exactly in our current time, inefficient dealing with people returning from abroad. As I mentioned before, I think that in schools we can do a better work in terms of testing. Similar things with red and orange zones. There could be much better way of dealing with it. But if you get into a situation where you have the healthcare system being overwhelmed, then you have no idea. But for me, having a lockdown, it's like when you have a patient with with a wound that you can treat it by cleaning, bandage, etc. But you're postponing from different reasons. Finally, you need to amputate your leg. I'm sorry that I'm very drastic here, because a total lockdown, in a way, it's a so-called simple. I mean, of course, it's not simple, but it's not a proportionate measure. It's a very not sophisticated, because it's just all over the board. And sometimes you have no other way because you're already there with many, and now unfortunately we're very close there, but I still think we can avoid it, and it's especially frustrating because we're going to start vaccinating, but vaccination going to influence only, as I said, like in 3 months, 4 months on the population level. So that's the situation right now.
Any more questions?
Yes, this is Alfred Muller for the Dutch newspaper Reformatorisch Dagblad. Thank you very much for your presentation. Maybe my question is a little bit premature, but is your team and the government also thinking about a kind of green passport for the future for tourists and pilgrims who want to arrive in Israel? Or did you not think about it yet?
Right now, the green passport is for Israeli citizens that, of course, we have jurisdiction. I just want to tell you that according to the international health regulations that, were enacted in 2005, but we can go back to the 19th century to the international sanitary regulation. In some ways, we have already such systems. There are countries that you cannot visit there if you don't have, it's like a passport with what vaccines you got, and it's updated according to the most of the time according to the World Health Organization. We know different diseases such as yellow fever. In the past, we had similar things for smallpox before the eradication. So in many ways, this is not something new. What is new that the green passport now can be much more efficient because it won't be just a piece of paper, but it will be something on our smartphones. Or in any country, you can, if someone is coming from an endemic place, and now there is a pandemic, so many places are endemic, meaning that COVID-19 is prevalent there. So you can have different measures being taken. I think a green passport might be one of them. Right now, we are mainly dealing with Israeli citizens. I hope that there'll be some coordination by the WHO or other organizations such as IATA or others to have something that is standardized. Then it will create a much better and efficient system.
Thank you. Do we have any more questions? All right. Could you elaborate a little bit about the more challenging communities in terms of vaccination? I imagine that the Arab community and the Haredi sector will also will be very hesitant, let's say, to come and vaccinate. What is the government's plan, or what do you know their plan in order to explain and persuade them to get the vaccine?
Thank you. So first of all, I want to differentiate because the Arab sector, they have the highest vaccination rate in the country. So maybe it's a idea, and there are lots of work why this is true. It's part of, a society that is going, society in transition. So I know that sometimes people hear this and they're a bit surprised, but in Israel at least, and especially in the Christian Arab community, but not only, among all parts of Arab society, vaccination rates, the general vaccination rates are higher than in other parts. Within the ultra-Orthodox community, again, it's not a monolithic society, and of course also the Arab society is not monolithic. Within the ultra-Orthodox community, now there were lots of efforts. I myself was interviewed by different Haredi ultra-Orthodox newspapers, media. We are very happy to hear that yesterday, Rabbi Kanievsky, one of the most important rabbis within the ultra-Orthodox community, officially issued a claim that people should be vaccinated. He got his advice from Rabbi Führer. Führer is a well-known figure. He's very involved in the all issues of medical advice as a kind of a self-made person that became an expert in many fields of medicine. So I think that the call from Rabbi Kanievsky is extremely important, but I'm not naive. I mean, there were already many messages within the Orthodox community, especially from very radical parts that don't believe in the Israeli Zionist government against vaccinations. But this is true not just for the ultra-Orthodox community. Within the secular, what is called general Jewish Israeli population, there are some who are calling against vaccination. In Israel, most people vaccinate, and it's a small minority. Again, they're transmitting fake news. There is a group called Agenda 21. I think it's an international group. They have conspiracy ideas that actually vaccines in general are a conspiracy to sterilize all human beings, and Bill Gates is actually want to reduce the population by 15%, or really crazy idea. And unfortunately, sometimes some physicians even are joining them. But again, this is a very tiny minority. We need to fight them. We need to be on the social media immediately to counteract the argument. The main challenge, I think, is what we call not vaccine resistant, but what we call those who are vaccine hesitant. So they are saying, you know, it's a new vaccine, how it happened that it's so quick approved. So we need to explain how the process in emergency is working, that nothing was, there were no shortcuts, etc. And I think that having especially the healthcare workers going first on public to be vaccinated, and we're going to start this campaign on Sunday. This will be a very important part. We're going to have on Sunday evening a webinar with Professor Arnold Monto, a close friend. He's the chair of the COVID-19 vaccines approval committee of the FDA. He's from the University of Michigan, and we are working with us for many years, and he'll be with us. And today, hopefully, also Moderna vaccine will be approved. I don't see any reason why not. I know that the data, it's very similar to Pfizer. So we're investing lots of energies. And for your question, the idea is also to not to give just general messages, to target specific population in terms of language, in terms of culture, in terms of knowing, you know, who is a community leader or just a leader in a specific community, and approaching them in order to get the message out. So indeed, lots of efforts being invested in the already and in the coming weeks for the vaccine campaign.
Thank you. We would have time for one last question if anybody has one.
I have.
Yes, I do have a question.
Okay.
Sarah?
Yes, it's Sarah Lemel from the German press agency, DPA. I was wondering, do you have some more exact information about the number of vaccines that will be available in Israel? Because at first they said, I think this morning, that in the end it will be only Pfizer, but then somebody said also Moderna. So there was like lots of different information around.
Thank you. So for now, again, if today the hearing will go smoothly, as I think, and later, of course, we need the formal approval of the larger FDA. Today it's the subcommittee on vaccines, and then it should be approved by FDA, but usually it's more formal approval. So Israel signed a contract with Pfizer and Moderna. I'm very proud because I'm from Ben-Gurion University, and the chief medical officer of Moderna is a graduate of Ben-Gurion University Medical School. So it's a real pride. He's going to get a medal of honor from university, but that's more on a personal, institutional level. So Israel signed with these two companies, and then there are other companies that Israel had an agreement, like AstraZeneca, It's a different technology. It's not a messenger RNA. They had their own problems. I won't go into details. By the way, things are so dynamic. It's a fascinating topic. I'm dealing with pandemics in the last 20 years. And, you know, when we knew that it finally somehow arrived, but when it's there, in many ways, things are beyond imagination and very dynamic. It's very sad that what's happening, but in many ways, it's a great lesson about the role of public healthcare systems. We see what's happening in the US, and we're very lucky in Israel that we have, with all the problems, we have still a strong public healthcare system with strong community healthcare system. I'm saying that because, you know, vaccines are extremely important, but they're not going to solve the erosion of resources and infrastructure and the need for more healthcare workers in general, including in the periphery. So Moderna and Pfizer are now on the table. In some ways, it's good because they are two the same technology. So at least for the coming months, we won't have almost any dilemma because being vaccinated by Moderna or Pfizer is about the same. If now there'll be other vaccines available, like AstraZeneca, that it's a different technology, it's not messenger RNA, but a virus that is not pathogenic for humans being inserted the messenger RNA, so things will be more complicated. We know that the options may be to have other vaccines, but I think that for the coming month, getting into herd immunity, Pfizer and Moderna will be the main candidates. So there are other vaccines, and we need to remember that we don't know yet the length of immunity. Maybe there'll be mutations. Maybe COVID-19 will remain as a seasonal endemic disease, and so maybe we need to vaccinate every year. It's not clear yet. So I think it was a good idea to not. We have this phrase in Hebrew, I don't know in English if it's the same, not to have all of your eggs in one basket, to have you know, different options. So there are other options, but right now it's Pfizer and Moderna, and we're going to have millions of doses that will cover enough populations for now, and then we need to continue and do follow-up of adverse event and also follow-up of serological testing to see how long these vaccines are effective, and then we'll decide later on.
Thank you very much. I know that your time is limited, so we're going to end this here. Thank you very much for taking the time to speak to us today. Thank you, journalists, for joining. A recording of today's Zoom conference will be sent to you in a follow-up email. Have a good day. Stay safe.
Thank you so much. I'll be happy to get the recording as well.
I'll be happy to send it. Have a good day.
Thank you. Thank you. Bye-bye.